You are falling asleep. Everything is quiet. And then, out of nowhere, a deafening explosion goes off inside your head. A gunshot, a thunderclap, a door slamming so hard the whole house should have shaken. You jolt awake, heart hammering, completely certain something terrible just happened. But the room is silent. Your partner is asleep. Nothing has fallen. There is no one outside. Your phone shows no alerts. Everything is exactly as you left it. The explosion was only in your head, and it was so loud and so real that you lay there for 10 minutes convinced you were dying. If that has happened to you, you are not going crazy, you are not having a stroke, you are not hearing things. You have exploding head syndrome, and you are nowhere near as alone as you think. The first documented case of what we now call exploding head syndrome was described in 1876 by a neurologist named Silas Weir Mitchell. He called it a sensory shock. He had 2 patients. He wrote them up, filed the paper, and the medical world largely ignored it for about a century. It was not classified as an official sleep disorder until 2005. That is 129 years of people waking up in the night convinced they had heard a gunshot inside their own head.
Exploding head syndrome is real and surprisingly common.
Yes, you heard that right. Exploding head syndrome.
With no explanation, no diagnosis, and no way to find out whether it would happen again. Most of them probably never told their doctors, because how do you explain that? Doctor, I was falling asleep and there was an explosion in my head. No headache, no pain, just an explosion, and then nothing. It sounds made up. It sounds like anxiety or a nightmare or imagination. So people kept it to themselves, lay there in the dark, wondered if they were losing their mind. Here is what was actually happening. The human brain does not go to sleep all at once. It transitions. The neurons that handle sound processing do not all power down at the same moment. Some go quiet before others, and occasionally this process misfires. A group of auditory neurons that should be quieting down instead fire off simultaneously, sending a signal to the brain that registers as an extremely loud sound. There is no sound. There never was. The neurons created it entirely from inside the system. It is not a hallucination in the psychiatric sense. It is not a seizure. It is not a sign of anything structurally wrong with the brain. It is the brain's shutdown process glitching. A brief, harmless electrical misfire at exactly the wrong moment. Think of it like a power surge when a computer shuts down. The machine is fine. The files are fine. The noise was just the system doing something it occasionally does wrong. That is it. That is the whole explanation. The reason it feels so violent and so terrifying is because your brain processes it as a real external sound. Your threat detection system activates instantly. Your heart rate spikes. Your body floods with adrenaline. All of this happens before your conscious brain has had a single second to evaluate whether the explosion was real. By the time you are fully awake and looking around the room, your nervous system is already in full emergency mode, and there is nothing there, which is somehow more frightening than if there had been. E.H. was 58 when it first happened, widowed 3 years earlier and already sleeping badly. One night, as she drifted off, a gunshot inside her skull. She sat up, heart pounding, completely certain something had exploded in the room. Nothing had. She called an ambulance. They ran an ECG, normal. Blood pressure, normal. Neurological exam, normal. They sent her home with the explanation that sometimes these things happen. It happened again the next night. This time she went to her GP. He ordered an MRI, normal. Blood work, normal. He referred her to a neurologist. The neurologist ordered an EEG, measuring electrical activity in the brain during sleep, and watched her overnight in a sleep lab, wired to monitors, waiting for it to happen. The EEG showed a brief burst of electrical activity in the auditory cortex at exactly the moment she jolted awake. No seizure, no stroke, no bleed, just a misfire. A cluster of neurons in the sound processing region of her brain firing simultaneously for no structural reason, generating a sound that existed nowhere except inside her nervous system. The neurologist had a name for it. E.H. had never heard it before. Most people haven't. But once she had the name, once she understood what was actually happening, the panic attacks stopped. She still had episodes occasionally, but she knew what they were. And knowing what something is takes almost all of its power away. As great scientist Marie Curie once said, "Nothing in life is to be feared, it is only to be understood."